Hello, everyone. Thank you. So, hello. It gives me great pleasure to introduce Professor Michael West to you. Michael is here to talk to us about leadership for quality healthcare, about the delivery of compassionate care. He works with the King's Fund at the moment. He's a professor at Lancaster University. Is that right, Michael? He's always very interesting to listen to. Always has very thought-provoking things to say. So, as with the previous speaker, if you have any questions you'd like to pose to Michael, use the Slido app, and there'll be time at the end of his presentation for me to put them to him. Okay, thank you very much, and I'll hand you over to Michael.
Do I need one of these Beyonce things, or I'm all right? Okay. So, hello, and it's such a privilege to come and speak at in this organisation, because you're doing so much, which is such a great example to health services across the country. I have the privilege of being involved in learning about health services in this country, and it all seems very complicated and at times very pressurizing and fairly scary. And so I keep kind of trying to reflect on what is it all about. And I kind of think that fundamentally, when the health service in this country was set up, it was set up because we had a national value that was really important to us as a nation, and we still hold it really dear, and that is the value of compassion, that we care about providing care for people who need it. We care about enabling people to be the best that they can be. And all of the people who work in East London Foundation Trust at some point in their lives made a decision to dedicate an enormous part of their precious lives overall to caring for their fellow human being. Around 80,000 hours on average of their precious lives to caring for their fellow human being. And that's a really profound and important value. And so I think when it all gets very complicated, it's about stepping back and saying what we need to do is create conditions where the people who work in East London Foundation Trust can do what it is they most want to do. And that is to provide high quality care for patients and service users and carers in this community. It's how can we create the conditions that enable them best to do that? How can we create the conditions to ensure that there's continually improving care? And how can we create the conditions to ensure that the care is compassionate? And that, I think, is the leadership challenge that faces actually everybody who works in the organisation. What can I do on a day-to-day basis that will create the conditions for everyone I work with to provide that high quality, continually improving and compassionate care? So I think that there are 6 things that emerge from all of the research that we've been doing that are really important for us to focus on. And we have some slides. And I want to talk very briefly about each of those. The first is that it's really important that we hold on to the vision of what this is all about, because it all gets so complicated. There are policy documents. There are things called 5-year forward views. There's the press, who I've come to think of as rather like ambulance chasers, you know, like the lawyers who chase ambulances. The press chase ambulances to put in the paper stories about when things go wrong. So it's really important, I think, we hold on to a vision of what this work is all about. It's about, for our fellow human beings, providing continually improving high quality and compassionate care. And I think it's really important that each of us holds that vision each day in our work, because otherwise we can get so overwhelmed by all of the stuff that goes on. But it's coming back to what is it about? What am I here to do? And holding on to that as a personal vision, as well as that being a vision and value of the organisation as a whole. So we need everybody from the board to people right across the organisation, I think, holding on to that vision. The second is the real importance of translating vision into clear goals and objectives. So what we see in the NHS is people being overwhelmed by priorities. Everyone's setting priorities, whether it's NHS England or the regulators or boards or directorates, everyone's creating priorities. And often the people who are delivering care or providing services in finance or HR are overwhelmed by all these priorities. And it's really important that we clarify what are the few really key objectives that we need to be pursuing, including objectives around quality improvement. And we make sure that also we are gathering data not to feed the beast of the regulators and CQC, but gathering data which helps people do their jobs better so they can learn about the quality of care that's being provided, the level of compassion, the extent to which we're continually improving care. So I think it's everyone's responsibility to ensure that they have just a few clear, challenging, inspiring objectives, and it's everyone's responsibility to make sure that they're getting the information and the data that tells them how they can improve their work. That's what quality improvement is really all about. And we have to, I think, as communities in organizations, really make sure that we are challenging this proliferation of priorities and objectives and focus on the few key things that are really important, including quality improvement. The third is, I can summarize the third point by saying, if we want staff in our organizations to treat patients and service users and carers with respect and care and compassion and dignity, then we need to treat staff with respect and care and compassion and dignity. Actually, we need to treat each other with respect and care and compassion and dignity. That's how we create cultures of compassion and caring. So I keep using this word compassion. It's one of those words you can't disagree. You can't disagree with? What does it mean? So Mason. So if you're in distress and I'm going to be compassionate, I think what compassion means is that I pay attention to you, that I'm here and now, I'm present with you, with your distress. Second is that I then make some kind of come to some intelligent understanding of what the causes of your distress are, ideally in conversation with you. And the third is that I have an empathic response, that I feel your distress at some level. And the fourth is that I then take intelligent action to help you. That makes sense? Compassion. So if we want to create cultures of compassion within which quality improvement will be really effective, then it's about paying attention to each other, being here and now with each other and with patients and service users, understanding the situation that they face, having an empathic response, and taking intelligent action to help. So we need to create the conditions in our organizations where compassion is the way we do things around here in all of our relationships. And we have a lot of evidence about the links between how staff feel and the quality of care that patients experience, and between what staff say about their leaders and what patients say about the quality of care that they have. They're very direct associations, and we've demonstrated them very clearly in all of the data that we have. So it is really important that we create conditions where all of the staff in the organization flourish, where they feel valued, where they feel cared for. That's how we create cultures of compassion and respect and positivity. When I see the high levels of stress across the NHS, it really grieves me in two ways. One is because I know that the more stressed staff are, the lower the levels of compassion that they're able to communicate, to express to the people that they care for. Second, we know that the more stressed staff are over time, the more damage we're doing to the physical and mental health of the people who are delivering care in the NHS. And that's unacceptable. So it's really important that, it's really important, particularly in terms of QI, that it's not just about the QI techniques, it's about the culture we create. And it's about a culture of caring and compassion in all relationships, not just in the relationships towards patients and service and users and staff. Does that make sense? And when we get it right, we know that staff are much more engaged. What is engagement? Staff engagement. Everyone talks about staff engagement being important, and it is important because it's the best predictor in the National Staff Survey of a range of outcomes in mental health, learning, disability trusts, in the acute sector, and so on. But what does engagement mean? The man who devised the concept said, to understand engagement, imagine an actor coming to perform on the stage on a Saturday night in the Almeida or wherever. Engagement is the extent to which she brings of her life experience to the performance of the role, her courage, her compassion, her emotional intelligence to the performance of the role. So when we talk about engagement, we're talking about of staff, we're talking about the extent to which staff bring of themselves, of their humanity, their compassion, their courage, to the delivery of care to patients and service users and carers. So it's really important when we think about engagement that we don't just see it as a kind of abstract term. It's about people bringing of themselves to their work every day in the NHS. And we know that engagement is a really important predictor of outcomes, and we know some of the factors that are associated with high levels of engagement. It's in organisations, in trusts, where there's a really strong vision around high quality care that's embodied by everybody rather than just being a bunch of words on the website. It's places where organisations have really transformed the way that they lead. So there's much more participative, supportive, compassionate leadership rather than directive, hierarchical leadership. It's places that have done really great things around quality improvement in enabling the staff to do quality improvement, like East London Foundation Trust and Salford and Wrightington, Wigan and Lee and the lovely Northumbria. It's places where people are enabled to do what they want to do, which is to improve the quality of care that they're providing to the people they care about in their communities. And the fourth is, these are organisations where there's a very high level of trust, where, for example, issues of discrimination against black and minority ethnic group staff are not so profound as they are across the whole of the NHS, where issues of fairness and discrimination are being dealt with, so there's much more of a sense of fairness and therefore trust. And we know that trust is what really predicts engagement. And there are organisations where there has been relatively stable senior leadership. So you can't allow Robert to retire. You're going to have to shackle him down. And what does it look like? So Wrightington, Wigan and Lee has done lots of work around quality improvement and staff engagement. And I was at a meeting of their engagement committee about 15 months ago, when they kept talking about the horse, and I didn't really understand. So I said, well, what's all of this about a horse? And they said, well, there was a lady, sadly, a few hours from death on the palliative care ward. Some of you will know this story. And one of the staff asked her, is there anything we can do in these last hours? And she said, well, I'd like to see Bronwyn. Who's Bronwyn? Bronwyn was the horse I raised over a 25-year period when I worked in the stables at Haydock Park. So the nursing staff got together and called the family and asked them could they bring Bronwyn in a horse box, and they said yes, and they wheeled the patient out on a trolley into the car park, and the horse recognised the lady and walked over and nuzzled her and kissed her, and somebody took the photograph and it was seen by 5 million people around the world. And it was an example of what quality improvement means in practice. And it's the kind of thing that happens every day in NHS organisations and every day in this organisation. And it's what quality improvement means. It means high quality care. It means compassionate care. It means continually improving care. And it's also, so it's about how we enable that in practice. It's not, it's about the culture that we all create within our caring organisations. Remember, compassion is at the core. And the last thing to say about this issue of people management is we need to create positive environments. Healthcare, by its nature, is a place where there is suffering and pain and hurt and fear and anguish. We need to manage our organisations. Each of us needs to take responsibility for managing our organisations, so we add to the pool of positive emotion, not unnecessarily adding to the pool of negative emotion, by being by showing gratitude, by showing appreciation, by being warm, by being optimistic where appropriate, by using humour to communicate, so that we create an environment where people do feel positive, because that's good for our health, good for our ability to be compassionate, good for our ability to be innovative and creative, Kevin. And so it's really important that we do that. And that we also confront behaviours that are aggressive or intimidating and unpleasant, because those are as dangerous to patient care as medication errors. If I'm afraid to challenge somebody because he or she is intimidating, then it makes care much more dangerous, it makes the context much more dangerous. And the fourth is the importance of having an environment where learning and innovation and quality improvement are the norm. And the work being done at East London Foundation Trust is a beacon across the country that many people look to. But it's really important, I think, that that process is seen as continuous, that we make that the culture of the organisation as a whole. And finally, this has already been mentioned, the importance of team working. We know that team working is fundamental to high quality care, and that there's an enormous amount of work to do to improve the quality of team working in NHS organisations. Team working is how quality improvement happens. It's through teams that quality improvement happens. So we have to continue to build strong team working, and for all of us to take responsibility for the teams we work in, to make sure that they have a clear direction, that they're working effectively, that we're communicating effectively together, not just by email, but face-to-face, because that's where the best human communication happens, and where we model in teams listening and valuing every person's contribution, no matter what their professional background, their ethnic background, their sexuality. We listen to everybody and value them equally, so that we create the best possible outcomes that we can for those we serve. And I would really want to also emphasize, in these busy organizations we work in, the fundamental importance of being still. We work so hard, we're so busy, and when the pressure gets higher, we seem to think that if we spin the hamster wheel faster, we will do better. But actually, all the evidence we have is that teams that take time out on a regular basis to stop, reflect, what are we trying to achieve here? How are we going about it? Are much, much, much more productive and much more innovative than teams that don't do that. Be still, reflect, peace. It's about the kind of thoughtful environment and reflective environment that we create. And finally, it's about creating collective leadership. I've kind of implied this. We are all leaders. We need to move away from hierarchical command and control to everybody taking leadership responsibility in the organisation. And I'm very proud of the fact that at NHS Improvement, we're working with East London Foundation Trust as one of the pioneer organisations in the country to develop leadership strategies to implement collective leadership across the organisation, so that we really begin to create the kind of cultures that will make a profound difference for the people that we serve. So I want to finish by saying one thing, and that is, I've talked about compassion all the way through, and want to emphasise that actually compassion begins with us. That if we're to create compassionate cultures, as people who work in healthcare, we must first learn to be compassionate towards ourselves, paying attention to ourselves, understanding the situation we're in, having an empathic response, and taking intelligent action to help ourselves, so that we can then be truly compassionate to those we serve. Thank you very much. Thank you.
Thank you. Thank you very much, Michael. That was really, really interesting. I've got a variety of questions for you. And I suppose to start off with this one, in the current climate of national change, how would you suggest staff morale is maintained with such little autonomy to keep enthusiasm for QI and care?
Can you say it again?
Yes, I think I might need to.
Yeah.
I'm not sure I understood it. In the current climate of national change, how would you suggest staff morale is maintained, I guess, when there's such little autonomy in order to keep enthusiasm for QI and care?
Well, I think I kind of talked about it during the course of my presentation. I think it's really important how each of us behaves. It's important that each of us takes responsibility in every interaction every day for the culture of the organisation, because culture is the consequence of all of the behaviours that go on within the organisation. So every interaction by every person every day shapes the culture of the organisation. So when we come to those interactions, I believe, in a compassionate, supportive, positive way, then we shape the culture. And if everybody in the organisation is approaching interactions in that way, then we maintain that strength and that positivity despite what's going on at national level.
Thank you very much. Next question is, what role do you feel quality improvement has in improving leadership?
I think it's really important. You know, there is a new national strategy being developed for leadership in the country. It's going to be called the National Improvement and Leadership Development Strategy. It will have 4 elements. One will be spreading improvement skills across the country, so more people are going to be coming to visit you to learn about what you're doing. The second is the importance of developing continuous improvement across the system. The third is ensuring we've got the leadership in place everywhere, and the fourth is ensuring that we've got appropriate leadership development. One of the elements of leadership development, I think, must be helping leaders lead to do quality improvement. And that's not just about them having quality improvement skills, but knowing how to do quality improvement as leaders. So I think that we need to focus quality improvement efforts on leadership itself. So we need every leader to see that their leadership should be subject to quality improvement efforts and processes, because leadership should be a continuous learning process. It's such a privilege that we should be working to improve our leadership continually. So I think it's really, really fundamental to great leadership.
Thank you. So the next question is, how do we persuade the senior leaders of more healthcare organisations of the value of quality improvement thinking?
Well, you know, in a way, I don't think we need to. It's now going to be part of the national agenda. It's going to be what all of the, you know, they call them the arm's length bodies, NHS England, CQC, NHS Improvement NICE. They've all come together and agreed that the National Improvement and Leadership Development Strategy will have 2 components of the 4 focused on quality improvement. Every organisation in the country will be required to be focusing on quality improvement and spreading quality improvement skills, because there's a recognition that that's the only way that we can respond to the challenges that the service faces in the current situation. So, you know, in a sense, there's no need to persuade them, because that's on the agenda now absolutely squarely. So more and more people will be coming here.
Okay, thank you. And finally, final question is, you've spoken in the past regarding the importance of humour at work. Please, can you talk about this?
So this is a little known fact, Andy, but when I finished university education, I went and worked in a coal mine for a year in South Wales. They didn't do much quality improvement there, but anyway. It was a really tough environment. I was working as a labourer there for a year. It's a really horrible environment. And it was so awful, I eventually made the decision to go back into academia, because I thought that would be better. How wrong I was. But actually, what was really interesting about working underground was 2 things. One is everybody looked out for each other. It just was, there was nothing more important than each other's safety. And the second is everybody was just funny all of the time, because it was a way of kind of compensating for what's a very, very harsh, unpleasant environment. And, you know, humour is just so important. It was a way of communicating safety and closeness and valuing of each other, And it's also, we know, a way of helping us to think more creatively. So when we use humour, we're much more creative in the way we behave, as well as being more positive with each other.
Great, that's fantastic. Ladies and gentlemen, should you join me in giving Michael a great vote of thanks for his...
Thank you very much. Thank you. Thank you very much.